One application of this basic notion about the mirror mechanism has been in rehabilitation of people which have some impairment in their motor abilities. And so there have been several attempts to do that. The principle is that if you have a motor system which is impaired, if you try to use it, and simultaneously you see somebody doing it, you have double input. And so the strength of these two inputs, it's so strong that sometimes you can start to move at least partially. So the idea is to have the possibility to interact vision and your own will in order to increase the synapses, the strength of excitation. And when you increase it, then it becomes a kind of positive loop. This has been achieved in different ways. One way, which we did here in Parma some years ago, is just to present the movies and ask the people to repeat, starting with very simple, like closing the fist, and then going on. In Parma we have few patients, but this has been taken over by a group in Chicago and in Lübeck in Germany. And although the number of patients is not very high still, it's only I think 10 or 12, there is a good improvement in their motor capability, and also there is an improvement in their brain activations. Then recently, this system, this mechanism has been tested here in Italy on patients not with stroke, but which have injury on the leg. And after, if it has been immobilized the leg for many days, or especially in big accident in which both leg has been broken, so their rehabilitation is very long. If you use also the vision of their legs when they try to move it, the rehabilitation is much faster. And for example, this orthopedic surgeon said that in many cases they don't have to use two crutches, but with just one stick after 2 weeks they can use. So that's another large number of patients. They have, I think, 80 patients, 40 with rehabilitation based on mirror neurons, and 40 only with traditional. So that's another field in which the mirror mechanism. And then there is another possibility which has been invented by Ramachandran. He invented it for phantom limb therapy. But the principle is the same. So you have a mirror which show, let's imagine my hand. So you have a mirror here, and so you don't see your hand, but you see the mirror image of this hand. So it seems to you to have two, right and left, although you see not the left hand, but the mirror image of your right. And again, this instruction the same. For example, close both hands. So you see both hands closing, and you are very happy because also your paralyzed hand apparently is closing. But this trick allows your really paralyzed hand to move more. Again, for the same principle I said before, because he tries to do sort of an input from the prefrontal lobe, which say close it, but also the visual input, which say close. Plus, you have reinforcement because it seems that, oh, okay, but I am good. I am closing my hand. And so that's a kind of reinforcing element which increases the will of patient to continue with this stuff, and apparently they improve. It should be proven on many patients, unfortunately, but it's very difficult in all countries because when the patients are better, they don't want to continue, or the relatives don't want, or they live in a village, they want to come back to the hospital. But what is interesting that these techniques are liked by nurses. So other techniques that the nurses don't like, instead to have movie or to show this mirror stuff, it's well accepted in the wards.